Welcome back. Well, last month, more than 54,000 people waited more than 12 hours in accident and emergency departments across England. That's the second highest figure on record. Let's bring in Dr. Ellen Welch, GP and former co-chair of the Doctors Association, joins us now, and also author of the book, Why Can't I See My GP? Thanks so much for joining us on this. So the statistics yesterday obviously showed marginal improvement on some measures, but also highlighted once again the scale of this extraordinary problem. Do you think that waiting lists, let's say in a 2 or 3 year time horizon, will fall significantly, or are we only ever going to be looking at marginal improvements here and there?
Well, I think with investment it is possible, but I think we need to look at the statistics from general practice as well. General practitioners are seeing 1.4 million patients per day. That's 32 million people a month. So the demand is enormous. We are often seeing the people on those waiting lists who are waiting for care, they're getting sicker, and then they come back and see us. So the demand in general practice at the moment is enormous.
It's interesting you said there, we need investment. Is it as simple as that? And are you fearful, if it is a question of needing more money, that there's not going to be that much around, whether it's Conservatives or Labour in power? It's not like there's money falling off trees.
Well, there isn't, but quite frankly, we need investment. GPs are now seeing 20% more patients than we were in 2019, but we've had a 20% real terms cut to our funding. We just don't have enough money to do the work that we're expected to do. So we need to invest in the service to preserve it.
Are there structural things ahead that you're hopeful about, whether it's rhetoric from one party or the other, or things like AI and technology, health improvements that could make a real sea change to these lists?
Well, no, I think the NHS workforce, the staff, are the biggest resource that the NHS has, and that's who we need to invest in. I think GPs are the only part of the health service that have seen a reduction in the number of staff. So we've lost nearly 2,000 GPs since 2015. We need to invest in our staff, and we need to invest in making things better for them and making them stick around so they're not leaving overseas to where conditions are better.
And what's the simplest way to achieve that?
Again, going back to funding, we need to increase wages, we need to encourage people to become GPs, we need to boost the workforce so that we've got enough people to deal with this demand.
In terms of the nation's health, are there any simple levers that can be pulled that could reduce the number of requests for GP appointments? Are there certain areas in particular that could see some improvements?
Well, one of the things I suggest in my book is to put the NHS on the school curriculum and to start from a young age, just to talk to people about how to manage minor illness, how to navigate the NHS, just general lifestyle, well-being advice, I think from a young age would be beneficial.
In terms of the last year or two and all of the debates over pay and strikes, where is morale at the moment amongst GPs? I'm sure it's not at any level of peak compared to the last couple of decades, but has it also come off the lows of the last couple of years, or not really?
Well, for sure, the last few years have been brutal, especially for GPs. We know that GPs are burning out. We've had GP suicides. Morale is rock bottom, for sure.
Dr. Welch, thanks so much for joining us. Very much appreciated.